So this is our mid-year Staff Appreciation Day. So give yourselves a hand again.
When Dr. Gibson comes up with a program idea, she's not thinking about today. Today is not the issue. We want to create systemic change that impacts the communities and how services delivered tomorrow.
We're coming into the neighborhood. Small town. I remember growing up, there were more businesses open, and we had a hospital, but the hospital closed some years ago. And so basically, if you're in Belzoni and you need to go to the doctor, so you got about a 30-minute ride, we're in an area where people have a lot of health issues, and you just can't get to the doctor in time. I knew that I could rise above the Mississippi Delta, above all of the things that was happening around me, simply because of my parents. They grew up in an era of complete and total racism and discrimination, and they knew what their kids would experience. And so they built us a little differently. They made us strong. My daddy believed in women so much that he really felt that I could do anything I wanted to do. And so I grew up feeling that way. And so for me, I wanted to change how healthcare was being provided to the most underserved communities, to people who feel marginalized, people who are afraid to go to the doctor. They're afraid of how they're gonna pay for it. Now, Open Arms is a special place. It's actually what I created. My Brother's Keeper started out as a training organization. We did not have a clinical arm. We didn't know what to do. We're taking so many elements and matching it to what the community actually needs. They calling.
97.7, the beat of the capital. What's going on, Jackson? It's your boy, Mr. Main Event. And man, we are live right here at Salvage World. We out here with Open Arms Healthcare. Now, they are out here pretty much trying to get everybody tested, right?
Extremely valid and simply put. So gives you an opportunity to get a complete, comprehensive health screening. That's syphilis, gonorrhea, chlamydia, HIV, glucose, cholesterol, BMI, Hep C, Hep B at no charge out of pocket.
It's very important to meet people where they are. You can't provide services effectively if you do not know who you are working with. So meeting them where they are means that you honestly are providing patient-centered care.
I come here often and get tested anyway. It's free, like, why would you not want to know your results?
We're going into all of these communities who may not have clinics near them, by them, and I staffed it very personally. You're gonna see a lot of Black men. Men have the worst healthcare traditions. They're afraid to go to the doctor or they go too late. So I wanted them to be able to identify with the people who were working on the unit.
We have to create these brave, safe spaces, and I got to just applaud Dr. Gibson for the work that she's done in creating a brave, safe space for individuals. Not only are the ones that work there, we are diverse, but we go out into the community, we are connected with individuals, we're empowering them.
My healthcare ambitions created a new vision for how we could go from just being an organization in Mississippi to being nationally recognized throughout the country as a change agent. The role that Gilead has played for My Brother's Keeper has been, they give me money to dream. I don't know who we would have been if we hadn't had someone who believed in us, someone who felt like we could do it, someone who, said dream. Go, dream big. Dream as big as you want within your budget, but dream big. If I could change Mississippi and hope for the ripple effect to change the rest of the country, I think the first thing that I would like to see is just a new level of kindness. And from there, we can move into how healthcare works. That's how change happens, person by person. And if you keep doing it, if you keep that thing going about, if I just can get one, eventually you may get them all.